Okay, good morning, everyone, and thank you, UPMC, for having us here this morning. I'm Denise Johnson, the Physician General at the Pennsylvania Department of Health. I've been an OBGYN physician for over 25 years, and I know how important it is for vaccinations for the health of pregnant people and their developing babies. At the same time, pregnancy is a very vulnerable time. And with all of the misinformation out there about the safety of vaccination, it's a persistent barrier for those to access vaccination during pregnancy. So with the COVID-19 pandemic, we know that pregnant people are at increased risk for severe illness if they develop COVID-19. We know that they're more likely to be admitted to the intensive care unit if they become infected with COVID-19. The changes that your body undergoes to accommodate your pregnancy can make you at increased risk for complications of COVID-19 like blood clots and severe lung injury and other complications of pregnancy. A recent report by the CDC looking at over 1.2 million hospitalizations for deliveries between March 2020 and September 2021 noted that individuals were 4 times more likely to have stillbirth, especially after the emergence of the Delta variant. And despite all of these increased risks of COVID-19 in pregnant people, there is still some reluctance to get vaccinated. We know that the scientific evidence for the safety and the effectiveness of the COVID-19 vaccinations is increasing. The data suggests that receiving the COVID-19 vaccines outweigh any known or potential risks of vaccination during pregnancy. And there is no evidence that the vaccines, including COVID-19 vaccines, can cause any fertility problems in men or women. And in fact, COVID vaccines are recommended for people who are pregnant, people who are breastfeeding, people who are trying to get pregnant now, or interested in becoming pregnant in the future. And additionally, people who are pregnant should receive their booster shots. Early data on the safety of the mRNA vaccine, so that's the Pfizer, Moderna vaccines during pregnancy, show that there have been no safety concerns for people receiving the vaccines. And in fact, the vaccines, when they are received during pregnancy, build antibodies the same as if you weren't pregnant. And the antibodies in your pregnancy can show up in the umbilical cord of the baby and can provide protection for your baby as your baby is developing. Additionally, in breastfeeding, we know that vaccines, when people receive their vaccines, their antibodies do present in breast milk and may give the opportunity to protect your newborn child before your child is able to be vaccinated. Reports have shown that vaccinations are safe and effective and recommended in pregnancy. Also, scientists have not found any cause for concern of vaccines in pregnancy when they are received during pregnancy. There's no increase of miscarriage for people who receive these vaccines in pregnancy. But it's important to note that we see these risks in people when they have COVID-19. So if you're pregnant and you've gotten your first dose of vaccine and you haven't gotten your second, please get that second dose to get that added protection. And if you are eligible for a booster, anyone 12 and older who is 5 months out from their primary series is eligible for a booster, do get that booster shot. Since the beginning of the pandemic, we have been following the science and following the CDC guidance to inform the decisions that we make. We know that the information on the virus continues to evolve, and we keep monitoring. And that's why it's important to follow pregnant people during all trimesters to get more information on the vaccinations. But these are highly recommended. They're safe and effective. They protect moms and babies and families, and we recommend vaccinations. I'm going to move over. It's my pleasure now to introduce Dr. Siobhan Moman-Nelson, who is the chair of the Department of OBGYN at the UPMC Carlisle Hospital. Thank you.
Thank you, Dr. Johnson and Acting Secretary Klinepeter, for being both a strong example and advocate for the vaccines in pregnant women. My name is Dr. Siobhan Moman Nelson, and I am currently the chair of the Department of OBGYN at UPMC Carlisle. Since the beginning of time, pregnant women worry about their baby's health, and as a mom of two, one 12 years old and one 15 years old, I'm not sure that motherly worry ever goes away. This is normal, but the stakes are high during this pandemic, and with the low COVID-19 vaccine rates we are seeing in pregnant population, many parents are opting for what feels safe rather than what is safe. The consequences for remaining unvaccinated can be dire. Unfortunately, scientific studies have proven over and over again that pregnant women are at a higher risk of severe outcomes if they contract COVID-19. But fortunately, scientists have also proven that this is largely a preventable problem because of how safe and effective the vaccines are for pregnant women. Over the past year, tens of thousands of mom-to-be received the COVID-19 vaccine and gave birth to healthy babies without any evidence of negative effects on their pregnancies or the babies. Similarly, tens of thousands of women received the COVID-19 vaccine before getting pregnant and have not had any struggles related to infertility. Studies continue to be published that support COVID-19 vaccines are safe for pregnant women. Last week, the American College of Obstetrics and Gynecology showed that fully vaccinated women, regardless of timing of vaccine initiation, transmitted higher levels of antibodies to their babies at the time of delivery. The study also showed that third trimester booster doses in association with the highest maternal and umbilical cord analysis levels. So getting vaccinated is not only for a mother's safety, but also for their babies. Often due to misinformation, only 30 to 35% of pregnant women in the United States are vaccinated against COVID-19. Sadly, in our area, those vaccination rates are even lower. I encourage all pregnant women to talk to their providers, to get their questions answered and their concerns addressed, to be fully educated, and to make their own decisions about vaccination. I also encourage all women of reproductive age who are considering pregnancy to get vaccinated to decrease the hesitancy of vaccination during pregnancy. Once again, I thank the Pennsylvania Department of Health and Dr. Johnson, and I would like to welcome Secretary Klinepeter for further comments.
Thank you so much. I really appreciate UPMC hosting us today. I appreciate your partnership and everything that you're doing to vaccinate women across the Commonwealth. I also want to thank all of our healthcare heroes and the tens of thousands of other heroes in the healthcare systems across the Commonwealth who continue to make sacrifices for all of us. You truly deserve recognition. I also want to thank the many people watching today or who will see these remarks later who are getting vaccinated, boosted, and tested. Those who are isolating and wearing your masks in public. You are making a difference. And now for the reason we're here today. Reinforcing that the COVID-19 vaccines and boosters are safe, effective, and recommended by the CDC for women who are pregnant, recently pregnant, who are trying to become pregnant, or who might become pregnant in the future. I recognize that this is a deeply personal choice, and I know that there is a lot of misinformation out there about the vaccines and pregnancy, so let me reassure you. First, I wanted to share that I am pregnant. My husband and I are expecting our first child, a baby boy, in June. So I understand the emotions, the hope, the anxiety that occurs when you know that there's a little person growing inside of you. I'm sharing this news publicly because I want my story to help other women across the Commonwealth make the best decision for themselves and for their child. I am vaccinated, I am boosted. I intentionally received my booster after I found out that I was pregnant. And thanks to scientists, to doctors, specialists, and my great teammates at the Department of Health, I feel confident that I made the right decision for myself and my child. In fact, last week, the CDC released a report that was started because of a reluctance by pregnant women to get vaccinated. The report from the CDC details that vaccines are safe and effective for all mothers wishing to be already or just recently pregnant. But they also note that COVID-19 vaccines prevent severe maternal morbidity and adverse birth outcomes. The CDC also found that women with symptomatic COVID-19 during pregnancy have more than a twofold risk increase for intensive care unit admission, invasive ventilation, and a 70% increased risk for death compared with non-pregnant women with symptomatic infections. It's not just about us moms, it's also about our baby. Studies also show that the antibodies mothers develop in response to these vaccines could protect our little ones. That's why we are pleading with you to get vaccinated or at least have a conversation with a qualified healthcare professional. My desire and the desire of the doctors and nurses across the state is for you and your family to be protected. One final note, if you are pregnant and watching this, we want to stress that the CDC does offer personalized health check-ins through their vSafe registry during pregnancy. I'm registered through vSafe, and it was a really simple process, and I strongly encourage other women to use this resource as well. In addition to check-ins that the CDC provides, the smartphone-based tool gathers information from people who received the COVID-19 vaccine prior to or during pregnancy. This information, should you decide to share it, is critical to helping people like you and healthcare providers who are attempting to educate themselves further and make informed decisions about vaccination. Before I close, I'd like to say thank you to my husband, Ryan, my parents, former Acting Secretary Beam, my colleagues at the Department of Health and the Governor's Office for their unwavering love and support during this time. Again, I appreciate everyone being here today. I encourage all of you to get vaccinated yourselves and to encourage your family, loved ones, and neighbors to do the same. And now we're happy to take questions.
No.
Go ahead, Dennis. Oh, I'm sorry.
No, it's
You go.
okay.
Go.
Hi, Madeline Cudahy, Fox 43. First of all, Secretary, congratulations. Big news. So incredible to see 3 women standing up there talking about this important issue. My question is about boosters in general. Obviously, we've been talking about pregnant women today, but the CDC has recently changed their recommendation for people getting another booster, a 4th booster, if you're immunocompromised. I wonder if you could talk a little bit about the concept of adding another booster during this rise in Omicron, and if you think that Central Pennsylvanians who are not immunocompromised might also be getting more boosters down the line.
Sure. So in general, getting a booster shot is extraordinarily important to protecting yourself against Omicron. Today, only a third of eligible Pennsylvanians who can receive a booster have received one. So I can't say in strong enough terms that if you've been vaccinated and had your primary series, go today and get a booster shot. It is the best thing you can do to protect yourself and families. I'm certainly happy to defer the more clinical response to Dr. Johnson or to Dr. Nelson for further information.
Thank you for that. In terms of the people who are immunocompromised, they have been recommended to have an additional dose. So whereas most people with a 2-dose vaccine get 2 doses, they would get 3. And in addition to getting those 3 doses, then it is recommended a booster. That is only for the people right now who are immunocompromised. We are analyzing the data on a continuing basis, but there's no recommendation for people at this point to get a 2nd booster or a 4th dose unless they're immunocompromised.
Thank you so much, ladies.
Mm-hmm.
Secretary Klinepeter, can you shed more light on the timing of your booster, like why you chose to get it at that time that you referred to?
Sure. So I got it November 10th when I was 8 weeks pregnant. And I chose to get a booster then because it was recommended by the CDC for women who were pregnant, and I felt it was the right thing to do for myself and my child.
Secretary, congratulations again. Get lots of sleep now while you can. Can you talk to me about the Wolf administration's philosophy towards this pandemic? We've got record numbers of cases here and across America, and yet there aren't any shutdowns. Are you considering perhaps another emergency declaration or shutdowns? I see the farm show is still running. Some people are saying that's a dual message. There are other people saying all this Omicron is a cold. Everybody's going to get one, and then the thing will be over. That's a thought too. Just can you give us your thought on what the administration's belief is on this thing, and have you now taking a more hands-off approach and allowing things to happen, businesses stay open and all of that, or is there any consideration of an emergency declaration again?
So the Wolf administration and the department in particular feel strongly that we believe Pennsylvanians will do the right thing. That means getting vaccinated, getting your booster, testing before you go out to a large event such as the farm show, and wearing your mask when you're in public. Masks are a highly effective tool at preventing the spread of the highly transmissible Omicron variant. And so we are not considering further mitigation at this time. Instead, we have appealed to the Biden administration to bring in resources from the federal government, and we've also announced additional resources that the Department of Health will be standing up this month in order to support our hospitals, such as UPMC Harrisburg, in order to ensure that they're going to have sufficient capacity. But that's why we really are appealing to every Pennsylvanian to do your part and to protect yourself and your loved ones.
Seems to be a little bit of a change from the first year and a half of this pandemic. Did the constitutional amendment have anything to do with that? Have you changed kind of, okay, if that's what the people of Pennsylvania are thinking, that's the way we're going to go?
We've always had the opinion that Pennsylvanians will do the right thing. I think certainly the constitutional authorities that the governor and that the Secretary of Health have are different at this time. And we've certainly heard people's perspective that they would like to be able to make local decisions, and so that's really what we're leaning on, is for people in local places of authority to make good public health decisions, and it's really the Department of Health's responsibility to make sure that we're providing accurate and scientifically driven information so that people can make those decisions.
Hospital leaders that I've spoken with as of late are saying that we're really in a crisis period right now where we're seeing COVID surges, but we're also experiencing extreme staffing shortages, more so now with limited staff because of COVID cases. So do we feel like the Wolf admin bringing strike teams in at the start of February might be a little bit too late to deal with the current crisis that we're combating now?
Right now, we do have 2 federal strike teams that are deployed, one at WellSpan York, one at Regional Hospital of Scranton. In total, those have brought online about 30 beds. And so while we're grateful to the Biden administration for that resource, it's definitely not sufficient to deal with the number of hospitalizations we're experiencing right now. We anticipate that we are not at our peak by way of cases right now, which means we are not at our peak by way of hospitalizations right now. And so we are anticipating that that peak will happen roughly sometime in early February, maybe a little bit later, depending on when the peak in cases happens, because we know that there's a lag, about a 2-week lag between cases and hospitalizations. So we will have those resources in place by February 1st, but again, as we're able to get contracts done and we are able to bring staffing online, we will not hesitate to move forward expediently and bring those resources to Pennsylvanians as they're available.
Have you considered doing a vaccine mandate, especially as Dennis had pointed out earlier that we have the farm show going on right now, coming out of the holidays? Is that something that is on the Wolf admin's agenda?
So since almost 75% of Pennsylvanians are vaccinated right now, we know Pennsylvanians are making the right choice. We're certainly waiting to see the Supreme Court's decisions, particularly with respect to healthcare workers and the vaccine mandates there, as well as the OSHA rule. But we are not considering further vaccine mandates at this time.
Secretary, first off, congratulations. I'm wondering if you can elaborate, what's the buy-in been on boosters at this point in Pennsylvania? Do you have any, can you give us an idea on what that buy-in has been like statistically, just given that we have an idea of who's fully vaccinated, but I'm wondering, based on the boosters' availability, how many Pennsylvanians at this point have actually bought in and you know, if you feel you're satisfied with the progress we've seen so far.
So roughly 33% of Pennsylvanians who are eligible have received a booster. And so, no, we are not satisfied with that. I cannot strongly encourage people enough to go get your booster. It is the best thing you can do to protect yourself and your loved ones against the highly transmissible Omicron variant. Vaccines are widely available. We do not have a shortage of vaccines. You can make appointments, at a local pharmacy or many other healthcare institutions, and we strongly encourage you to do that today.
Just to follow up on a question Dennis asked earlier, obviously a lot of the things that the health department did earlier in the pandemic got very politicized in many ways. I'm wondering, do you guys feel like you have the ability to go ahead and implement measures if it comes to that, despite the previous sort of political back and forth? I mean, does that play into any decision making going forward?
Well, we certainly are taking action by deploying the 3 different types of strike teams that will allow for regional decompression of our hospitals, short-term staffing relief at hospitals that are experiencing an acute shortage, and building out capacity in our skilled nursing facilities, which hospitals desperately need so that they can discharge patients there. So certainly we are taking action in order to support our healthcare system at this critical time, and we're really focused there right now.
Aside from the federal strike teams, is there any staffing help going to any hospitals in crisis right now? Or do you know of any that are in crisis right now? And are you able to give them any help before February?
So we've been working very collaboratively with hospitals and health systems. Every couple of weeks, I actually host a call that all hospital C-suite preparedness and EMS teammates are invited to. And we've been working collaboratively with them to help load balance across different systems, talk about diverts and the like. Through that forum, we have shared different staffing agencies that have come to us and said that they have staffing that is available, and we've shared that directly with the hospitals. As well, our colleagues at PEMA have helped hospitals who are nonprofits and have eligible expenses get reimbursement for some of those staffing costs and other costs associated with the pandemic. Last week, PEMA hosted multiple workshops that hospitals could attend to get a better understanding of how this FEMA reimbursement process works. So at this time, the department will be seeking FEMA reimbursement for the strike teams that we will be deploying this month and next, but we don't have funding to provide to hospitals or nursing homes to help offset some of the extraordinary costs that they're experiencing related to staffing.
And can you tell us more about what the regional sites will look like in terms of how many you expect there to be, and whether they will be, like, say, housed in tents or in, like, non-healthcare buildings?
Yeah, so we anticipate there will be 4 regional decompression sites. We are still selecting where those sites will be. We'll likely make that determination towards the end of this week based on this week's data of both hospitalizations and case counts across the Commonwealth. We will not be setting up any type of tent. So we will be using the existing healthcare infrastructure that is out there. So we'll be looking to partner with hospitals that have more licensed beds than staffed beds. And then we will be putting the clinical staff in place to provide direct patient care to COVID and non-COVID patients to help decompress hospitals across the region. So really, from a patient's perspective, it'll look seamless. It'll look like they are in a hospital that they are comfortable with in their community, and really they shouldn't see much of a difference in the experience of care.
Yeah, and just to clarify your answer to my question about whether you had the ability to immediately send staff to any hospitals, if I heard correctly, I thought I heard you say that the state didn't have funding, but did you mean to say funding, or did you mean to say didn't have staffing?
Both. So we're working through a process with PEMA right now so that PEMA will get an advance from FEMA in order to use that funding to pay for the staffing that we intend to deploy this month and next. But the Department of Health does not have either federal or state funding currently that we can use to send staff immediately out to hospitals.
Do you know what the status on the application to the federal government for help with testing in South Central PA is?
I So we know the status of one of the applications. We're waiting for the results of the second, but we will have news to share tomorrow.
Could I ask Dr. Johnson a question?
Absolutely.
What do you make of that thought about this Omicron is less severe? If you're vaccinated, it appears to be less severe, and that everybody's just going to get a cold, and then that's kind of the way this thing's going to end. Any truth to that in your view? Can you address that?
So I think that we have seen that there have been milder cases with Omicron, but remember that this is not homogeneous, that there are some people that still are getting very ill. And because we have so many people that are getting Omicron now, even if a small percentage of people get seriously ill, that still is a lot of people. And so there still is concern. We still know that receiving your full vaccination series and booster helps to protect against those hospitalizations that are impacting the capacity of our health systems. And so our message remains the same. Get fully vaccinated, get boosted, and even in the face of Omicron, this is probably more important now to make sure that we maintain the capacity of our hospitals to take care of those critically ill, heart attacks, strokes, broken legs that will come in. All of us need to do our part, and we have a part that we can play and can make an impact.
One more question? Thank you. Does somebody else? Okay. What's the status of monoclonal antibody treatment right now in Pennsylvania? I mean, I ask that in light of the fact that, two of the ones that had been working real well no longer work, and then the one remaining one seems to be in very, very short supply all over the country. So I'm wondering if we still have enough to give to the people we would like to give it to in Pennsylvania.
Monoclonal antibodies are a highly effective treatment for people who are at high risk of severe illness at helping to keep them out of the hospital. And so certainly we would like to see more sotrovimab, which is the monoclonal antibody that is effective against Omicron, coming to Pennsylvania. We are allocating all monoclonal antibodies across the Commonwealth in an equitable way right now, but certainly we would like to see more come into the Commonwealth and more Pennsylvanians be able to be treated with this effective and safe treatment. Okay, thank you guys.